My name is Dawn Ewing. I'm here in the United States. I'm the Executive Director of the International Academy of Biological Dentistry and Medicine. I would like to talk on dental interference fields and how dentistry can impact patients both positively and negatively. In biological dentistry, we consider the root word bios as life, and for us, all the rest is just logical. We do pay attention to Dr. Voll's work and the fact that he stated that 80% of all health problems could be directly related to the mouth. We do pay attention to meridians going through the body and understand that there's a chi or a life force that goes through those different meridians. It was demonstrated by Dr. Kim Bon Han, so we know that it actually exists and that it is not imaginary, it's invisible. So we teach our doctors to think of oxygen in the air. You know it's there, but you can't see it. If the energy is flowing through these pathways, then what happens when there's a short or a blockage in that pathway? That's what we want to talk about. Is there science to show that there is a tooth-organ connection? Absolutely, and it's not new. It's stuff that's been around for quite some time. So for those that are skeptics, I like to gather plenty of information so that they can go through and see that I'm not cuckoo crazy. Well, I might be, but that the information I'm sharing is not totally off the wall. Dr. Voll was the one that discovered the relationship between the teeth and the organs. And we do know that there's a dental foci where you can have an infected tooth that impacts a different part of the body. Again, I looked for some peer-reviewed journals so that I could show the connection between the teeth and different diseases. And of course, we know periodontal disease and cardiovascular disease, but this is not what I'm talking about. So what is a dental foci? It's a concentration of toxins where the body has attempted to wall it off by surrounding it with lymphocytes. Or it's an area of dead tissue, or possibly even a foreign object. And examples would be osteonecrosis or possibly an implant. Any of these can block the flow of energy on that particular meridian. Basically, that energy gets to a black hole and it disperses in different directions. So not all of the energy gets to its intended target. It's interesting that the energy can be blocked at either end. A patient could present with dental work on symmetrical teeth on opposite sides of the mouth. And in that case, I want you to think that there could be something that caused those two particular teeth to decay, instead of what we were traditionally taught is that it's all about brushing and flossing. And an example would be that you could have a maxillary central incisor that could have a dental problem, whether that's decay in the tooth or pain in that area, or even an abscess with no decay, that it could be due to something on the other end of that meridian, like an ovarian cyst or a kidney or bladder infection or uterine fibroid or even prostate issues. Vice versa, it can also mean that a dead tooth or an infection or a cavitation where a tooth has been removed, or possibly even an implant, could affect the organs associated with that tooth. So I want to give you an example. This is a 50-year-old male that has virgin teeth, but he comes into the office presenting with decay. But there are only 2 teeth decayed. The upper right second molar has gross decay on the mesial, and we see that the lower left second bicuspid has decay on the distal, but no other teeth have decay. Now, if we think of the traditional cause of decay, we would tell this person they aren't brushing and flossing. But in fact, he is brushing and flossing, and his teeth are really clean. So why just those 2 teeth? I did testing on this individual using EAV, and when I finished, I said, okay, there are 6 out of 8 teeth that are on a specific meridian that seem to be off kilter. What kind of thyroid problem do you have? No, I don't have a thyroid problem. Really? When's the last time you saw a doctor? Oh, it was way before COVID. Oh, that's right. They told me I had some kind of a nodule on my thyroid, but I haven't gone anywhere and had it checked out. Well, come to find out, he has a horrible thyroid problem. So you can have something as gross as thyroid cancer that would affect all of those teeth and not another tooth. So why did the second bicuspid decay, but not the first molar on the lower left? If you follow this chart, you see that that upper right second molar is on a green circuit. That is on the same electrical circuit as that lower left second bicuspid and all the other teeth that were showing up with problems. So traditionally, we would root canal one tooth, offer a crown, or we would extract that tooth. And then we would fill with a composite the bicuspid, and we would send him on his way. I'm telling you that we have information now that says he's set up for future decay or future teeth to abscess. So there needs to be a tight connection between a primary care physician that understands a tooth-body connection and a biological dentist that knows when to connect that patient with a biological physician. This is a good example of what we call a pan focus, which is when there's something so burdensome to the body, in this case his thyroid, that it affects things that are not normally affected, even so far as to affect things on another meridian. I like to explain to patients that you think of it like a circuit in your home. If you had something like your particular appliance, like maybe a dishwasher and a garbage disposal that aren't working, and you know they're on the same circuit breaker, you could go out and check your breaker box and see if it tripped. But if it didn't, then an electrician would come in and check the different outlets to find out where the electrical disconnect is. Replacing those appliances won't help if it's an electrical problem. We want a closed circuit so that everything lights up. When we have an open circuit, that's where we have this electrical disconnect. And your body being electric, that causes a problem. Infection or a dead tooth or even an area of a dead jaw or an implant can open that circuit, which is the electrical disconnect. So is there such a thing as a healthy root canal? That's what I was taught in school, that you could do a root canal and tell the patient that they would have a healthy root canal. It's an oxymoron. You can't have a healthy dead something. We can say that it functions well, but it's not necessarily healthy. The way I like to explain it is if you have a lamp and you plug it in and you turn it on and it works, that would be a great example of a body and how it's functioning correctly. But if I cut the cord to the lamp, immediately the light will turn off because the electricity can't jump the gap of where there's no wiring. Now I could take an X-Acto knife and leave the cord in place, but trim it, peel it apart, and cut out an inch of wiring, and I'll get the same effect. But when looking at it, the lamp is still plugged in. So it looks like it should function, but we have the same problem. In both cases, we have an electrical disconnect. If I call an electrician and I say, wow, somebody cut the cord to my lamp and now it won't work, is there a way to repair it? The electrician will explain to me that he can splice the wire back together. He can remove all of the dead air space if the wiring is on the floor. And the moment he brings those two wires together, the light will come on. In the case where we opened the casing for the wire and cut out the wire, we will have to cut that empty gap. Unfortunately, that means removing the tooth. When you remove the tooth and all the dead bone, the body reconnects that meridian instantly. Your body was designed to heal. If you cut yourself and you're walking down the street, you don't have to look up what happens in the clotting cascade. Your body is just designed to have that kick in, and we don't have to think about it. The tooth itself, in this case for a root canal, created the void, which is the electrical disconnect. So while I'm waiting for the electrician to show up to repair my lamp, my dog decides to poop on the wire. Now that's gross and it smells horrific, but that's not the issue. The issue is that the wire is not connected. I understand that there's bacteria inside the tooth, but that is not the issue. Again, your body is designed to be able to handle that. The issue is we're trying to pick up a phone line that is not connected. I can go through the motion of dialing for an ambulance, but I won't get one if that phone line is disconnected. But nowadays we have lasers and ozone and even a gentle wave. So can't we do a better root canal? Well, I can remove the wire and I can sterilize the wire, but it still won't make the lamp light up because I have that electrical disconnect. So the analogy I like to use is I have a cat that died. He's on my countertop in the kitchen, and I do see a couple maggots on him. So I decide to call an exterminator, but I don't want toxic materials piped into my home. So I find someone who uses ozone. That's a much healthier option. And certainly it does a good job. But a few weeks later, I notice that there's still decaying tissue and I have new maggots. So I call the exterminator and explain I want my money back. He asks me, "You didn't bury the cat?" "No, it's my favorite cat and I plan on him staying there." You can sterilize a root canal, but you will have to do it over and over again because we just don't have a way to remove all of the dead flesh. And it's in God's plan and design to send bacteria to gobble that flesh up. And because it's in a dark, moist, warm environment, it multiplies. This is examples of a patient that had a root canal lasered and then because of discomfort chose to have the tooth removed 3 weeks after having that tooth lasered. And the place that we sent it shows the amount of inhibition in enzymes that have to do with the production of ATP. So this one tooth reduced the amount of the body's ability to create ATP by 38%. 6 months later, the patient chose to remove 3 other teeth because they had continued fatigue that was not helped by glutathione at all. And in that case, we see that those 3 teeth together reduce the body's ability to create the ATP by 78%. Nowadays, we have different testing that we can do. We can do PCR testing on the bacteria that is inside the tooth. That is not what I worry about, but I do acknowledge it's there. This case is interesting because this patient was very difficult to test and to treat because she had tremendous tremors. She just couldn't sit still at all. But at the moment that these 2 teeth were taken out, and I do mean the exact moment the last tooth was removed, all tremors stopped. She has since gone back to her rheumatoid specialist and to her neurologist, and they can't explain why it stopped. We got the PCR testing back, and we see that many of these particular bacteria have to do with neurological effects. And I broke it down in a different way so you could see the columns here and how those specific bacteria can interact with the body. So yes, all root canals have bacteria, but that is still not the main issue. You can sterilize that tooth over and over and over again, and you're still going to have that electrical disconnect. Most of the teeth have 8 teeth on a meridian, with the exception of the wisdom teeth and the eye teeth. All the rest of them have 8. And so if you could imagine for just a moment an 8-lane freeway with traffic going on it, and all of a sudden a tree falls over all 8 lanes of traffic, bringing all the cars to an instant stop. Now, I could tell you that the tree has African bees in it, and it has a lot of different mycotoxins in it. But the reason I can't get my car to go forward is because of the tree, not because of the bees or anything else that's toxic inside the tree. I could spray and kill all the bees, and I could use a fungicide and get rid of all the mycotoxins, but I will still have a dead tree blocking the road. So when we look at removal of a tooth and then talking about what we would use to replace it, we have some options besides traditional bridge work or removable partials that would involve implants. Titanium implants, all of the titanium has nickel in it. And nickel is a known carcinogen. And nickel is also known as a hapten, which can trigger autoimmune. So we're not very fond of using titanium implants in a biological office. Sticking titanium in a jaw is similar to sticking a fork in an electric socket and bending it around and sticking it in the bottom, which could short out the entire socket. Imagine for a moment that my 8-lane freeway now has an electrical pole that falls over and all the electrical wires are firing off everywhere, zapping. My alternative to the titanium implant is a zirconia implant, but zirconia is completely non-conductive. Instead of having something go across all 8 lanes of my freeway, I now have the example of one stalled car in only 1 lane of traffic on that 8-lane freeway. It's not the same burden, but imagine for a moment that all of a sudden there are 8 cars side by side. That would completely block that freeway. So I need a dentist who is well-intentioned to help a patient connect with a physician before they place an implant to see if that person can tolerate giving up a small amount of electricity going through that meridian in that particular area. This was a slide I borrowed from a conference that I was at showing the different nickel content in some of the titanium implants. Dentistry can be so valuable to good health, but we have to be very keenly aware of what we do in the mouth and the fact that it impacts all the rest of your body. Even a bite can affect the rest of the body. And we need to remember that there's nothing as good as what God gave us to begin with, so our focus should be on prevention. I don't want you to shoot the messenger, because I do understand that oftentimes I talk about things that aren't the standard of care in traditional dentistry. But I do like for a dentist and a physician to create a team approach to patient care so that the physician can inform the dentist when platelets are too low or when a vitamin D needs to be bumped up before an extraction is done, and that a dentist networks with that physician to make sure that materials that they're going to use or an area that they may compromise won't be a problem for that individual. So I'm going to encourage those that listen to this, if you want to contact me, there are 2 ways. You can connect with me at drdawn@drdawn.net, or you can go through the International Academy of Biological Dentistry and Medicine by going to executive.director@iabdm.org. And I want to thank you.